The monkeypox scare has now reached Delhi. The capital has reported its first case of monkeypox virus after a 34-year-old man with no history of foreign travel has tested positive. This is India's fourth case, with the remaining 3 coming from Kerala. As per the information so far, the individual had attended a stag party in Manali. However, showing symptoms, he was admitted to Maulana Azad Hospital 3 days back. Now he has been isolated in Lok Nayak Hospital. His samples were sent to NIV Pune on the 25th of June, which came out positive. Now, as per the sources, the contact tracing of patient is underway. This, remember, comes a day after the WHO had declared monkeypox a global health emergency. Now, Delhi Chief Minister has reacted to this and he has tweeted to say that there is no need to panic. Remember, this is the first case of monkeypox being reported from the national capital, with Delhi Chief Minister Arvind Kejriwal reacting. Akanksha, tell us the details of what really has been the reaction.
Well, absolutely, as you rightly pointed out, a 34-year-old man has tested positive for the monkeypox infection. Now, Health Ministry has also issued a statement stating that that person is currently at a isolation ward at LNJP Hospital. He is currently recovering, and his close contacts have also been identified. The identification of the source of infection, enhanced contact tracing, testing of practitioners is also being carried out. Now, with this, the total number of cases all across the country has climbed to 4. Before this, 3 cases had come out from Kerala. After this news of this infection being a man turning positive in Delhi came forth, Delhi Chief Minister has reacted saying that there is no need to panic. The situation is under control, and in fact a separate isolation ward has also been created at LNJP Hospital. Contact tracing has also been initiated. If we talk about this man who has tested positive, he had attended a party in Himachal Pradesh, after which he was admitted to a Delhi hospital 3 days ago. His samples were sent to National Institute of Virology, which came positive with the monkeypox virus. Now, with this, the total number of cases has climbed to 4. This comes a day after WHO.
Because in fact, even the center has now come out with a statement on this latest case that has been reported from the national capital, and in the statement they have said that the person in question, who is a resident of Delhi, has been isolated, as you were pointing out, at Lok Nayak Hospital as a suspected case of monkeypox. Further public health interventions like identification of the source of infection, enhanced contact tracing, testing, sensitization of private practitioners, etc. are being carried out. Akanksha, what really should now the Delhiites be mindful of?
Well, as you know that this virus spreads from animals to human via direct or indirect contact, and human to human via direct contact through respiratory droplets or through infection when one comes in direct contact with this skin infection. But now everyone should take care of this, because this is the first
Akanksha, do stay on the line with us, because we now have Mr. Naresh Trehan joining us, Chairman of Medanta. Dr. Trehan, it is very significant that this person has no history of foreign travel whatsoever. How is that important?
It's worrisome. It's worrisome in the sense that till now we were thinking that it's basically only coming from outside. Now we have to track or trace all his contacts, because he could be in contact with somebody who's come from overseas. And that's how it spreads, basically. So one thing is that we just need to raise our guard much higher. That means, one, of course, when people who are traveling from outside, they should be inspected, at every entry point, so that we know that it's not coming from outside. The other thing is that if ever this case like this one that has been detected, we need to just jump on it and trace everybody who he was in contact with, to see if there is any one, whether he got it, who did he get it from, and whether other people are getting from him, because this is how it spreads. But right now, because the reported cases are so small, it is very possible to do very intense tracing and complete the whole process.
Right.
So, very worrisome.
Right. Dr. Trehan, what are the precautions that people can take in general now? Because even in this case, his sample was sent for testing a month ago on the 25th of June. 30 days is a very long period for him to be determined as a patient. He could have come in contact, and we could have several other people like him amidst us. What are the citizens in general supposed to do to avoid catching this virus?
See, basically it comes from physical contact. It's not a airborne virus. At least that's what we know so far, because you can always be surprised later on that it has different modes of transmission. But right now, what we know is that it is by physical contact. Now, physical contact, much like chickenpox, or in the old days where smallpox used to be, it comes from the discharge of the blisters that develop on the skin, there is concentration of virus there. And once that discharge comes in contact with somebody else, then it becomes a problem.
Okay. The signs are pretty visible even in the early stages in case there is a breakout like this?
Yes, but that means that everybody, first thing, the whole public needs to be educated that it's a real and present danger. We need to be cautious of, coming in close contact with people. And also only when you know that they're not exposed to, in the sense that you don't see any visual marks on them.
Okay. And right, and in case one does contract this, we've heard reports that smallpox vaccine has been said to be pretty effective in this case as well. What is the course of treatment?
No, but that is, you see, vaccine is always preventive.
Yes.
Vaccine is not curative. So basically, isolation, complete isolation, the virus usually will run its course, and immediately the contacts should be vaccinated. But that's all being worked out right now, because this is all new to everybody. So the point is that there is that person should be isolated even more intensely than in COVID. The second is the point that everything that comes in contact with their skin has to be sanitized right away. So these are the kind of precautions one needs to take if somebody gets it. And then, of course, the government, I'm sure, is working on accelerating the testing process,
right,
which will have to be done.
Right. Given the kind of scare that this has elicited, Dr. Trehan, would it be out of proportion for if people went on to get their children or even adults preemptively vaccinated with smallpox vaccine?
Well, I'm not sure of that, because this will have to be studied a little bit by our scientific community to look at the pros and cons and then decide whether it should be done.
Right. Thank you so much, sir. Right. Thank you so much, Mr. Trehan, for joining us with your extremely significant insights on this matter. Remember, the fourth case has been reported just a day after the WHO has declared monkeypox as a global emergency. Let's listen into what the WHO officials had to say.
The outbreak has continued to grow, and there are now more than 16,000 reported cases from 75 countries and territories. The information provided by countries, which in this case shows that this virus has spread rapidly to many countries that have not seen it before. WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region, where we assess the risk is high. There is also a clear risk of further international spread. The global monkeypox outbreak represents a public health emergency of international concern.
Stay safe, stay cautious. So with that, we take a very quick break.